Dr. Pete, as you saw, I led in with breaking news, and there's no one else I'd rather do some breaking news with. Dr. Pete, we're here today to talk about the resident who was found decomposed in a nursing home closet. I know I'm an administrator, you're a licensed nursing home administrator, so let's
Yeah.
dive into it. Without further ado, this is unscripted, this is unplanned, and it's just what we got going on. So, for the people who don't know, there was a resident found in a Miami-Dade nursing home, and this resident was found in a closet. Allegedly, these are all alleged. We don't have a 2567, nor have I read a police report. I can only report on the facts as I see them based on various media outlets. I will acknowledge that this is coming from various media outlets and it's not a 2567. So, based on the facts that I see it, a 71-year-old man was found dead in a closet, decomposed. Allegedly, this patient has dementia and signed himself out AMA. Went missing and essentially wasn't able to be found until staff found him in a closet. So, Pete, what are your thoughts?
It is an administrator's worst nightmare. The fact to have a missing resident and then not to recover the resident alive and well, and to find a resident that has died and his body allegedly began to decompose. It's just, I can't even imagine how this administrator is feeling. I can't imagine how the organization as a whole, if it's a corporate organization or is it a mom and pop nursing home, I don't know the facts, but this is bad. This is bad, and I'm sure the family wants some answers. Um, you know, I don't want to be in their shoes,
No, I don't think any of us as
and
administrators.
and I think that's why I drill this elopement every month, just about every month. I'm drilling the elopement with with the staff. I'll take a resident, hide them in my office, or do something, give them a hamburger if they can eat a hamburger, and make the staff go to work. You know what I mean? And they have to uncover every hole, every room, every bathroom. You know, they have to count all the heads in the building. Everyone go to their stations, report their count to the nurses station. I mean, it's extensive, and it's oh man, this is
You, you
it is
know,
heart wrenching.
it's gut wrenching to the point of what you said, and we're both licensed nursing home administrators. Um, and I want to preface this conversation with, you know, I would say 99% of facilities are great to be at. Your loved one's going to receive the care that they need. Once again, we don't know the rules. We don't know the plan of correction. We don't know what the facts are. We only can report on the facts that we receive. But based on the literature that I'm seeing, the resident went missing for 11 days. Missing report was filed on August 23rd, that the resident disappeared. Now, as I know it, based on the facts, is that this resident had dementia and signed himself out against medical orders. Now, for me as a registered nurse and me as a licensed nurse home administrator, my patients who have dementia who are requiring this level of care generally have some level of a guardian or some POA in place that we are bound to notify. So I have to ask, what happened for during that process? This was clearly an unsafe discharge. So what happened that POA or that guardian wasn't notified? I take it a step farther. Anytime there's an unsafe discharge, I'm dialing 911. I'm letting EMS police know. I'm also calling POA, as we've talked about. I'm going to call APS, Adult Protective Services, for those who don't know. And then the last call I'm going to make is to the long term care ombudsman. So if this patient did leave AMA, I wonder where those calls had. What are your thoughts?
Well, again, just on the outside looking in, I have the same questions like, what was his BIM score? I mean, just because you have dementia doesn't mean that you're not cognitive enough to make your own decisions.
I echo that.
Was he cognitive enough to make his own decisions? Did he in fact have a POA, or did he sign himself into the facility? You know, or did somebody else sign him in the facility? Does he have a responsible party that took care of that? And when he went missing, were they all notified? You know, uh, there's so many. I have so many questions. Again, it's hard. You can't pass judgment on this All you
No.
can do is speculate and honestly learn from this lesson and then beef up what you're doing at your facility to prevent that very thing from happening. So, without knowing the facts, it's hard to really say. But it begs to wonder if he was he missing, or was he allowed to leave AMA, and did we report it when he left AMA, knowing that he was not? This would not have been a safe discharge. Were were the various entities that you mentioned notified? The ombudsman, the police department, APS, you know, did we do a welfare check to see if he got home? You know, you know, there's so many questions here,
Yeah,
man.
and
Because just
you
because somebody has the right to leave AMA against medical advice, we still have a responsibility to ensure that they well, that's debatable too. If you're
well,
signing
no, but
AMA,
you always have a responsibility as an administrator, right? We are responsible. Even when a person signs an AMA, those at least 4 agencies or 4 people I told you about should be notified. We have to tie up loose ends because of like legalities reasons. But let's just say for the public, right, that he did not sign himself out AMA and went missing. To me, my mind is blown even on the search and rescue efforts.
yeah, yeah, yeah.
So I don't even want to talk about
But he
that.
was found. He was found in the building. If
Who's
he's
cleaning these closets?
if he left AMA, did we?
How?
How? I mean, who picked him up? Um. So
You
how
don't.
how
You're not AMA unless you walk out that door.
you see what I'm saying? So the fact that he left AMA but was found on the facility grounds in the bathroom, that's a whole new can of worms right there. Because if he left and then they were searching him for 11 days. You know, we didn't know he actually left.
So my question is, I go back to I've seen expired patients, and I know that after a certain amount of time, patients will begin to have an odor. My question is, if we have a housekeeping department and we have staff in the room, was this a room that was walled off from everybody else? Like, how did nobody open a closet for this amount of time?
Yeah.
To me, I just can't fathom that somebody did not open the closet, this amount of time. So what happens? How does something like this happen
Well,
when
was
you
he?
have
Did,
staff
did
in the
they know?
building?
Did they know he was missing?
What else could it be?
Was it an elopement, or was it that he left AMA? And you see what I'm saying? There's so many holes in here. If
So
it was an elopement, then there would be a process to search the facility, account for all the residents, search every hole, every door, behind every door, every closet, until the resident is found, and insert the properties, alert the authorities, alert the family, and alert the medical director, all those things. So that's the elopement process. But wasn't an elopement? Did he leave AMA? I mean, I don't know. I don't have the pieces to the puzzle. I don't have the
but
pieces to the puzzle.
to me, once again, I don't need to. I'm a human. I'm a registered nurse. I'm a licensed nurse. I'm an administrator. I don't need the pieces in the puzzle to say somebody was found in my building. I go back to who's cleaning these rooms, because you can't tell me that we've cleaned the closets. You just can't. You can't tell me that we've walked past this smell for X amount of time. How does this happen? And then even from a discharge, right? I was a nurse. I am a nurse. But I worked as an LP and I worked as an RN on the floor in long-term care in the hospital setting. The only time I didn't see a patient through the door, out the door, is in the hospital setting. Once they left my floor, got on the elevator, they were considered AMA. But in long-term care, I'm going to see you through because you know what I'm going to document? I am going to document how they left. Resident ambulated outside of the facility, got into a yellow cab, said whatever they said, right? I'm going to document that process as I see it. So my question is, if this person left AMA, I wonder what the documentation says to support a diagnosis or support AMA. Now, once again, I view it as an elopement based on the facts that is we've a resident eloped and they were unable to find this resident. But even what you mentioned with your elopement, I know I call a code E. Now I had an experience with elopement, and I think you know it, but I'll share with the audience. 3 months into me being an administrator, I had my first elopement. When I say that is the most jarring thing to go through. Have you ever had an elopement, Pete?
No, praise God.
Listen,
I hope not.
Dr. Pete, let me tell you something. When you get a call at 4 o'clock in the morning that your resident is not where they're supposed to be, that is the most terrifying thing. And I got a call at 4 o'clock in the morning that I had a resident who had eloped from my facility. My immediate question is, do a head count, flip over mattresses, check the kitchen. I mean, we're checking. I'm checking behind locked doors. Like I know they can't get in here, but I'm gonna recheck behind locked doors just to make sure. And that process is so rigorous that I'm like, how could we have potentially have missed a resident behind a locked door? And somebody posted in the comments, they said they're going through their facility making sure that all knobs can be opened from the inside, which is standard of practice. It should be, but my question is, how could this be prevented, Dr. Pete?
Woo. Training, training. We got to drill it. We got to drill it. The staff have to know the process and the procedures when those things happen for both an AMA and
Mm-hmm.
both for missing resident.
What's the difference? What's the
The other
difference?
thing, the other thing for me is, what kind of closet was this? Because
Tell me about it, man.
you know, some facilities don't have, they have the wardrobe size type.
Yeah.
Some do have the closet, but usually it's packed with resident stuff in there.
Yep.
Was he that disoriented that he was found that he went in the closet and locked himself in?
But
So
what closet should you be allowed to lock yourself from internal? And I think that's a good question. Somebody posed in one
yeah,
of the administrator groups I'm in. They said, how could that happen? And I can see if you're disoriented, but once again, if you're that disoriented, how are you signing AMA? I don't care if you have your and I'll say it, I'm a registered nurse. But if you come to me and you are ANO times zero, but you are your own person, this is not a safe discharge.
well, how do we know he was disoriented though? Do we even know that? This is just speculation, really. But again,
100%.
again, there's a lot of questions that need to be answered, and I'm sure they're going to be digging into that. Um, whew, you know, the difference between an elopement is that somebody has left without you knowing, is
Yeah.
left have left your view and left the
Agree.
property Um, but the against medical advice is somebody leaving supposedly of their own free will and educated about the risk about leaving before time, and has decided to leave the facility against the advice of the medical team and the medical director. At which point, the medical director is no longer responsible for that resident. But on the same token, we don't just say, well, good riddance. You know, what are we doing? If we suspected that he really wasn't um, one of those things, we should have, again, contacted the ombudsman, contacted the responsible party. Again, these are questions I still have. Did he sign himself in? Was he cognitive enough to sign himself? Somebody had to have signed himself in if he came in there with a brain aneurysm. You know,
We got a comment, and they said, "I'm not sure if this is an administrator. I'm going to put in the chat. Would you like to join? We'd love to speak with another administrator and get their perspective. So please let us know if you'd like to join the conversation." But the comment says, "This is one of the first things we check when our residents go missing: closets, bedroom, and other residents' rooms." I go back to once again how what happened that we did not possibly do that, right? So, thank you for that comment. And like I said, if you definitely want to join, we can send you the link so you can come up on here and talk from a perspective. Let's move a little bit over to just how we manage this now as an administrator. We've talked about what it's going to do to a facility, but how do you manage this as an administrator, as a leader who has discovered that one of your residents have been found in the facility's closet decomposing? How would you handle that, Dr. Pete?
Oh, there will be an extensive investigation process. Number one, how are we going to ensure that the other staff are going to be the other residents are going to be safe? The four levels. What did a plan of correction? What
Mm-hmm.
did the facility do? How did we determine what was the cause? Root cause of what happened. You got to do a root cause analysis. Where did we drop the ball at? And then you put plans in place to prevent that from happening again. And then you do a full audit. They're probably going to do a full assessment, elopement assessment on
Everybody,
on everybody. At this point,
the employees as well.
some people will say, anybody with a BIMS of 10 or less, we would
No,
do an elopement. At this point, I would probably assess everyone um, uh, completely, all the entire
you
building,
have
100%,
to.
100% audit to really see where we are. And then what was that process? Do we have a binder with all the elopements and picture and all the, that kind of stuff? Do we have an effective dementia program in the facility? So that people know these exit seeking behaviors. I was at a facility, but and for the sake of anonymity, I'm not going to mention that facility, but we had an activities director that was pulling dementia residents out of activities, out of the unit to do activities somewhere else. Well, now
Wow.
that gives them, this is behind a locked unit. So this
Yeah.
is giving them exit seeking behavior, right? And
Yeah.
so those kind of things have to stop. You
Yeah.
can do activities right there on the unit with them and provide all the different sensory things that the various dementia residents need. High stimulus, low stimulus, tactile things. Sensory things with their hands, painting. All the different things that you could provide right there on that unit, rather than pulling them out routinely, letting them know, hey, you can come out this door, routinely, and then now they're exit seeking, and then now they're in elopement risk.
You,
So a lot of this needs to be prevented. But you're saying, what do you do now that it has happened? You
yeah.
have to do a thorough investigation and find out the root cause, and then you're going to have to do a full 100% um, elopement assessment on everyone in that facility, and then review all the care plans. I mean, this is
Yeah.
100%.
This
And
is
then
gonna be
facility
huge.
going to prevent this from happening again? You got to take it to QAPI, and then you got to audit it. Audit this, several times a day, maybe several times a week. Then you scale it back, 3 months, 6 months.
This is going to be huge. And, I'll peep from my perspective. I went through an elopement. Let me tell you, baby, getting up at 4 o'clock in the morning is not fun. Immediately, 911 was called. No one could leave the building until I interviewed every single staff member to find out what it was that they were doing at the time that they were doing it. I've took statements from everyone. We did a head count on everyone, and everyone in the building received an elopement assessment. I joked earlier, but the staff received an elopement assessment. We updated and placed elopement books at every single nurse's desk and at every single exit. So if a resident were to elope, there's a picture of them, what they like, their likes, preferences, and we had that ready. So anybody can grab this elopement book. I take it a step farther. We updated the policy and procedure. We re-educated everybody on the policy and procedure, and we ran drill after drill after drill after drill. I can't say how many drills we went, but everybody knew Code E and what it meant for Code E. There was assigned people. If you were the first floor nurse, one of the first floor nurses, you went outside, you checked under cars. I don't care if it was a winter. You checked under cars. The other first floor nurse organized the team, and they went room by room, starting at the front all the way back, right? There was somebody who checked the alarm to see if a door was triggered. I mean, we had a systematic process because I was determined that under my watch, I would never have an elopement. And let me tell you, thank God I never had an elopement again. But as a new administrator going into any facility, that's the first thing I do. I pull their abuse policy now, and I pull their elopement policy. I want to see drills. I want to see the last time people was educated, because what we won't do is have someone who is harmed on my watch as an administrator, and subsequently, I'll share this and we'll segue over to this. As an administrator, I was brought to the board. I had to go in front of the board as the administrator. They took me. They said, look, you're the administrator's facility. Come on up and explain how you let a resident leave at 3 o'clock in the morning while you were asleep. That is something that I never want to experience. You never want to get a letter from an accrediting board in the mail saying you're being investigated. My name, Demetrius Kirk, was being investigated for neglect, for an elopement. I had nothing to do with it, but guess who was the administrator on record? It was me. So I was brought up as the administrator to the board. So I know, Pete, you've never said you've had any issues with any IJs. Have you had to deal with going in front of the board or anything?
No, no. Thank by
It
God's
ain't
grace.
fun.
No, I have not. But this is an eye opener for me. To make sure that when we're conducting these elopement drills, that the staff are opening the closets and the bathrooms and looking under the
Yeah.
beds and all that. You know, you could take this for granted and just sort of be paper compliant.
Yeah.
We did an elopement drill real quick. We
We're
did
good
it.
for paper compliance.
We just want to get it on the book.
Yep.
But it's really important to really drill this, because herein lies an example of now again, we don't know whether this was a true elopement or I still can't fathom, because the resident was found in the building. So
Yeah.
I'm not seeing an AMA here. I'm seeing more of a missing resident. This is not looking like an AMA to me, because if somebody goes AMA and signed out AMA, why are they still in the building?
100%.
Did we escort them?
There's going to be so much more to come out of this, and I'm sure we will get together and do many more of these lives as we start to peruse through 2567s and just talk about issues in long-term care and highlight the good in long-term care. So not all of these talks with Dr. Pete is going to be something along this line, but we felt we just needed to get on and talk about it. What you will see coming soon, more of me and Dr. Pete, is real discussions just like this from two industry leaders who are clinicians as well. I am a registered nurse by trade, Dr. Pete as a respiratory therapist. I always wanted to be one of those, as a respiratory therapist. So we are both dually licensed clinicians, been in long-term care. Between the two of us, we have over 40 years of experience in long-term care and healthcare leadership. So you're going to see much more of this from me and Dr. Pete. Dr. Pete, tell them how they can reach you.
Oh, YouTube at imdrpete.com. That's IMDRPETE.com. Or Instagram, I'm Dr. Pete. My LinkedIn's Dr. Peterson Merville, Mirville. Be happy to have a conversation with anybody who wants to. This is really important. Prayers to that facility and the families. I happen to be Haitian, so that resident was Haitian too. So that's blood right there. But prayers to the family and to the facility. This is a very difficult situation, and we don't want to point fingers because we weren't there. We don't know the dynamics. We're just simply talking and speculating about different scenarios and how things could have went or have gone. But again, the investigation will tell the tale.
Hey, I appreciate it, man. And for anybody who wants to follow me, I'm Demetrius at Your Healthcare Consultant on TikTok, Instagram. You can follow me on my YouTube, which is Sound Leadership with DJ. And yeah, hit that like, subscribe, and share. We love to see your comments as this unravels. And like I said, this is just the start of it with me and Dr. Pete.